Hello everybody, welcome to my YouTube channel Homeopathy Super Sessions by Dr. Jagos. Today I'll be doing the second part of Relationship of Pathology to Therapeutics by Carol Bennett. Now let us take a similar view of the science of pathology. So in part 1 we had seen the view about the science of physiology, the process of urination or the fact of urination. Now in this chapter or in this part, we are going to see a similar view on the science of pathology. In other words, it can be called the science of morbid physiology. So when the disease sets inside, whatever the normal physiological processes are there, they become morbid or they become abnormal. Hence, it is called the science of morbid physiology. Let us take an example of morbid salivation that occurs as a result of discharge of the abnormal salivary fluid. So now example is there of a disease condition in which you get a morbid salivation, which occurs as a result of discharge of the abnormal salivary fluid. The pathological explanation leads us to the selection of blood by the cell wall of the salivary gland. So this is very again important. Again, the cell wall will absorb the pathological process that is the blood, and the saliva will be stained with blood, or it will have blood with it. Hence, if the blood is normal and the saliva we have assumed to be supposed abnormal, it leads us to the fact that the cell wall must have been altered or impaired. So therefore, the impairment of the cell wall will lead the blood into the saliva. It implies that the manifestation of life must have become manifestation of abnormal life, which is disease itself. So therefore, whatever life was there or whatever normal phenomena was there, it became into an abnormal phenomena, which became a disease itself. Here, the seat of disease, which we found the seat of life, is an inherent attractive and selective power of the cell wall. So here, the seat of disease, where the seat of life is naturally found. So there is life, there is disease, there is health, there is disease, there is equilibrium, there is disequilibrium. So here the seat of disease is the inherent attractiveness and selectiveness of the power of the cell wall. Thus, Dr. Carpenter says health or normal life and disease or abnormal life. Dr. Bennett says that the attractive and selective power of the tissue is deranged. So in a disease condition or in abnormal life, Dr. Bennett says whatever attractive and selective power is there, or the attractiveness and the selectiveness power of the cell wall or the tissue is deranged. The selective power appears to be lost and the attractive power greatly increases. This causes the phenomena of inflammation. So out here says that when the selective power is weak or lost, but the attractive power is greatly increased, this causes the phenomena of inflammation. This becomes an important point in pointing to the pathology. Hence, the science of pathology, which treats the phenomena of disease, leads us to the science of therapeutics, which enables us to cure various diseases. So hence, the pathology, the science of pathology, naturally it deals with the disease condition, which will lead us to the science of therapeutics, and with the correlationship of pathology to the science of therapeutics, knowing its scope and limitations, will be able to cure the various diseases. Majority of the medical professions hold the science of therapeutics is based upon the science and the facts of pathology. So majority of the medical professions say that the science of therapeutics is nothing but it is based upon the science of or the fact of pathology. Dr. Bennett says if you take another case of inflammation, its treatment in the early stages may consist of topical bleeding, which may diminish the congestion, and application of cold will check the amount of exudation. So Dr. Bennett says that if you take a case of inflammation in the early stages, what happens? When inflammation is there, more blood is there on the affected part. So you have to bleed that part to let out the excess of blood. So initial stages will consist of topical bleeding, which may diminish the congestion. So naturally the blood will be let off, the congestion will be less. And then what do? Then subsequently, we do the application of cold water or cold application, which will check the amount of exudation. But the exudation have been coagulated outside the vessel, acts as a foreign body. Thus, the treatment must be directed to absorb the excretion of the matter. So further, he says that because of this exudation, which has accumulated outside the vessel and it acts as a foreign body, this treatment must be directed to absorb the excretion of the matter. This can be accomplished by local applications of heat and moisture and the internal use of neutral salts to dissolve the fibrin in the blood. Also, the use of diuretics and purgatives may be used to assist the excretion by urine and stool. So thus, to sum up the plan of treatment with this example, there are mechanical measures of bloodletting to diminish the congestion, then the chemical measures, use of neutral salts for exudation, and again mechanical measures, the diuretics for removal of the dissolved exudation from the blood. This plan only deals with the result of disease and not the disease itself. For congestion is a primary result of abnormal action of the cell wall, and exudation results from the congestion, which is a second result of the same abnormal action of the cell wall. So therefore, he says that the plan only deals with the result of disease and not the disease itself. Why? Because he says that congestion is formed because of an abnormal action of the cell wall, and exudation results, which is secondary to it. This clearly shows Dr. Bennett's words of attractive and selective power of tissue is deranged. That is, the selective power is lost and the attractive power is increased, as in the example of inflammation. The curative treatment must be directed towards the cell wall, which is the ultimate seat of disease. So in both these examples, in the physiological example as well as the pathological example, the treatment must be directed towards the cell wall, which is the ultimate seat of the disease. Every method which is directed to the result of disease, which are proper subjects of pathology and pathological anatomy, the results will be palliative in nature. Hence, if you would direct yourself only to the results of disease, then it will be palliative in nature. The specific modifying power of every drug can be ascertained in its absolute properties by testing it upon the healthy living organism. So, therefore, thus, whatever drug is there and its specific modifying power, it can be seen by testing it on healthy human beings. In this way only, it is direct and radical method of curing disease. So by this way only, you can directly cure the disease in the most radical manner. Thus, from all what has been said so far, the relation of pathology and therapeutics can be deduced in a few sentences as follows. Pathology is the science of disease based on the theory of the observed morbid process. So in pathology, we are dealing with the abnormal process or the morbid process. Therapeutics, when truly regarded as a science of cure, is based on theory of cure and resting upon firm foundation of experimentation. So therefore, he says that therapeutics, which is regarded or truly regarded as a science of cure, is based on theory of cure, resting on a firm foundation of experimentation. So only if you would experiment, then only you would be able to find out the drugs or the symptoms which are produced, and therefore by the use of the law of similars, you will be able to cure the disease. The art of medicine is applied directly to the remedial agent to the abnormal acting cell wall in such a way so as to restore the normal function. So therefore, he says the art of medicine, or medicine is an art in which you have to apply the remedial agents or the drugs where to the abnormally acting cell wall in order to restore its normal functions. In this way, it is clearly perceptible that the whole disorder originates from the cell wall. So therefore, it is clearly perceptible that the whole disorder or the main disorder will originate from the cell force. We are able to analyze the secondary and tertiary series of phenomena which results from it. Pathology forms the instrument which the physician avails of. Samuel Hahnemann has taught us to respect the scope and influence of pathology in relationship to therapeutics. So our great master, Dr. Hahnemann, has told us that always see the scope and the limitations and then only take up the case. Dr. Carpenter is of the opinion that constitutional disturbances are even more important than the objective symptoms. So therefore, Carpenter says that while treating a patient, whatever constitutional disturbances are there, they are more important than the objective symptoms. So the constitutional disturbances, in short, it is nothing but the subjective symptoms which the patient is feeling. He says that the subjective symptoms are more important than the objective symptoms. He further says that the study of conscious disturbances in depth which give us the entire functioning of the organism. So again, he said, Dr. Carpenter again reminds us that it is the constitutional disturbances, the symptoms of which, if we analyze in depth, will give us the functioning of the organism. This was the rule which Hahnemann strongly insisted. Even Dr. Hahnemann was of the same view. The entire organism of the patient should be examined in every possible way so that the totality of symptoms should be made the basis of prescription. So the whole entity or the whole human being or the whole patient or the whole disease individual has to be studied in the best possible way. Best possible way meaning what? The totality of symptoms. And that should be made the basis of prescription. The constitutional general symptoms are of great importance than the more obvious local symptoms. So naturally, whatever symptoms are constitutional in nature and more general in nature, they are more important than the local symptoms or the symptoms pertaining to the part, system, location, or organ. The old school authorities tend to remove the cause of the disease by mitigating the pathology. So the old school was of the opinion, or they were authoritative by saying that if you remove the cause of disease, you have removed the pathology or you have destroyed the pathology. This sort of treatment gives bad results. Furthermore, the doctrines were based on speculation, which resulted in worsening of the condition of the patient. So whatever authority the old school had, there was nothing proper to show that it was correct. Why? Because the doctrines were based on speculation. So whatever they did, they were just speculating that this particular remedy could be useful for this disease. But there was no experimentation, no proof to prove that. They just built castles in the air, or it is just known as theoretic medicine. So naturally, what was the result? If you speculate, naturally, there'll be worsening of the condition of the patient. The old school failed to accept the success of the founder of the homeopathic school. So the old school, basically, they only looked at the morbid cause, removed the cause, and the disease is mitigated. And they failed to look beyond that, that is into the dynamic aspect of the disease in which the founder of homeopathy, Dr. Samuel Hahnemann, has given us. So that's all in this chapter. So I hope you all like my today's lecture or today's session. So please do subscribe to my YouTube channel, Homeopathy Super Sessions by Dr. Jacobs.